Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare. Subscribe now and stay on the forefront of the digital healthcare revolution.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Chris Civit-Therese, and today I'm joined by Dr. Patrick McGill, board-certified family medicine physician and healthcare executive, currently serving as the Executive Vice President and Chief Transformation Officer at Community Health Network in Indianapolis, where he leads information technology strategy, analytics, digital transformation, population health, and value-based care initiatives. With over 20 years of clinical experience, Dr. McGill has held various leadership roles and sits on multiple boards such as the Indiana Health Information Exchange, and his accomplishments as Chief Transformation Officer have been recognized by Becker's Hospital Review in both 2022 and 2023. Welcome, Dr. McGill. It's great to have you on.
Oh, thanks for having me. Really glad to be here.
Absolutely. Well, today we're going to cover some ground, but we'll mostly be focused on a topic I'm really interested in getting into, and that's personalizing and measuring the patient experience, which is, a totally loaded topic, and for many, perhaps a pretty elusive topic too. So let's jump in. I'm really excited to get going. If you can, start by telling our audience a little bit about your background and your role today at Community Health Network.
Yeah. So my background is I'm a family physician. I still practice and see patients 1 day a week, and the other 4 days a week I serve as the Chief Transformation Officer and do all the things that you outlined. I have some other areas that I'm responsible for, like experience analytics, care in the home, post-acute, geriatrics, some of those. So really, you think about what a Chief Transformation Officer does, and my role is really to try and, like it sounds, transform the organization, push the organization forward, whether it's with digital technology, payer partnerships, the use of data, how we think about and measure the patient experience. But it's really, how do we advance the organization to deliver on our brand promise here at Community Health Network, which is exceptional care simply delivered.
Absolutely. And talk a little bit about, if you can, about how you go about marrying sort of the technology aspect of healthcare to the patient experience. I know a lot's been talked about and written, and, patient engagement has been a buzzword for a long time. Patient experience has been a buzzword for a long time. Interested in your perspective on sort of that marriage between technology and that experience.
Yeah, that's a great question. So we've always been kind of a process-driven organization. So where it started was, quite frankly, our journey 10 or 15 years ago is we were not doing very well with patient experience. We were probably in the bottom quartile or even lower on patient experience score, especially in the outpatient setting. And so we set out to make that better and went on a journey of working with our physician leadership, our frontline physicians and providers about how do we change that? How do we understand the voice of the customer? How do we understand what they're asking, what they want? And really, how do we deliver on that experience that everybody has in all of their aspects of their life? Really, that digitally driven experience, that personalized experience. How do we create that experience in healthcare that people have in other aspects? So we went on that journey. Our scores went up. We were, in the top 1 percentile. Then we said, that's not really enough. Top 1 percentile for healthcare. We said, that's not enough. We want to see how we compare outside of healthcare. And we want to benchmark ourselves against the top companies in the world, the people that you all know and think about when you think about the top companies of experience. That's really what we should be striving for. We shouldn't accept this mediocre experience in healthcare and say, well, it's healthcare, that's what it is. It's really, how do you create that top level experience that everybody wants and quite frankly deserves? And so, we focused on processes, we focused on technology, we focused on measurement, we focused on caregiver experience, because we know that caregiver experience ties in the patient experience. And you hear me say caregiver, we believe that all 16,000 people at Community Health Network are caregivers. Whether they touch patients physically or not, everybody has a role in taking care of patients and families at Community. So everybody's a caregiver.
I think it's really interesting. You touched on a couple of things I just want to follow up on. The first is sort of that notion of, the patient experience being at an organizational level, a commitment and a part of the culture, if you will. How do you go about fostering that kind of, I'll say, ownership sort of across the board to get 16,000 employees in a huge health system like you work under, to sort of, row in the same direction? That has to be a bit of an undertaking, I would imagine.
Yeah, you're right, and it is. And you start with some of your more typical change management aspects. We started with measurement and transparency on the data. We started with coaching. So we provided coaching for providers and physicians that were not performing well. We looked at our processes. We incentivized. So early on this journey, we incentivized through annual goals and other things, improvements in the experience scores. But now, for the last probably 5 or 7 years, we have not incentivized experience. It's kind of ingrained into our DNA, and it's who we are, and we truly feel like it's one of our differentiators when it comes to the competitive landscape in Indianapolis, and that our experience and what we can deliver has become, again, it's become part of who we are. It's how we identify ourselves. And pretty much every caregiver will tell you that's something that they're proud of. They're proud of the experience and the patient's first focus that they're able to deliver on when they come to work every day.
Really fascinating. And you also mentioned, that it's a pretty broad description of sort of the elements of the process and the strategy that you are targeting, all the way from technology, process, people, so on and so forth. I'm wondering if you have any specific technologies, tools, methodologies that have really, from your perspective, significantly improved access, experience, engagement, so on and so forth.
Yeah, we have a lot of your typical ones. We're an Epic shop, so obviously the EMR is huge when it comes to experience and engagement and outreach and connecting with people through the patient portal. We're a partner with Qualtrics. That was part of the journey that we transitioned to Qualtrics when we wanted to measure and benchmark ourselves against outside organizations or organizations outside of healthcare. We really felt like we needed a better way to be able to measure every step along the patient journey. And so we can talk more about that if you want. But obviously there's other technologies that we're looking at or that we've implemented, ambient listening in the outpatient offices to really allow the clinicians to focus on the patient versus typing on the keyboard. A lot of nursing assist tools in the inpatient setting, post-discharge connection, so that those engagement tools to understand how people are doing. Are they getting their needs met? Are there other things that they might need? And then all of your typical, patient reminders and e-check-ins and all those types of things. We feel like that's just the price of entry at this point.
Right.
But really, how do we take it to the next level to really create a lot of those experiences, make it seamless, make the health system journey frictionless? We always say we run a 24/7, 365-day business. We never close. And 99.9% of people don't want to be there. They're either sick, ill, they're in the hospital, they're having bad diagnoses or bad things happening to them. Outside of having a baby, that's probably the most exciting or reason that you would want to be at the hospital. Everybody else. So how do you take that kind of negative foundation and turn it into an experience that at least is palatable when people are going through some of the hardest times in their life?
Yeah, it's such a great observation there, and I really I'm interested to learn more also about how you sort of looked outside of healthcare for inspiration to bring those best practices into the fold. The relationship with Qualtrics is very interesting. I'm wondering, was it purposeful in terms of the ideation around strategies within healthcare? Was it purposeful to look outside of healthcare, or did that sort of come about, organically? I'll call it.
It was a little bit of both. It was a little bit organic in that we had achieved, the top level for so many years that we couldn't continue to statistically improve. And so we said, okay, we've kind of mastered healthcare. Let's start to look outside. Then as we started to think about, okay, what is the experience? What should it be? We start to look at other industries. You think about all those areas out in your other life and your outside of life outside of healthcare that you think about who delivers on an excellent experience, who has good service recovery, who is able to create a frictionless experience. And so it really changed how we think about measuring the patient experience. I'll give you a real life example. have been looking at access. Everybody's looking at access. Everybody has access challenges. We have provider shortages, nursing shortages. Access is a challenge. I don't care who you are in the country, access is a challenge.
Absolutely.
So, but as we were measuring access and wanted to know, we were looking at your traditional measures: third next available appointment, time from scheduling to having the appointment, all of those kind of more system focused measures. And we said, let's change that. Let's ask the patient, did the appointment that they were given meet their needs? So every time a patient schedules an outpatient appointment, they get a quick 2-question survey. Did the appointment meet your needs? Yes or no? They rate us on a scale of 1 to 5. If it's no, then they get another question about why. Was it your schedule, the provider's schedule? What was going on? And so we can really dive in and understand, are the appointments and the access that we're delivering, does it meet your needs? Thankfully, about 94% of people give us a 4 or 5 on that scale. So we're actually meeting the needs, and we're asking people, what do they desire? How do they want to experience healthcare? And I think that's a dynamic. We're also able to measure, historically on patient experience, you measure what we call the winners, people that were able to get an appointment, able to see a provider, able to get care in the hospital and the ER. What about the people who fall off, who can't get an appointment? How do you measure their experience? How do you measure the experience of family members? And we're thinking about all of those things right now.
It's really interesting. So the notion of measurement is really fascinating to me, and you are really sophisticated in terms of how you're measuring and what you're measuring, obviously. And when I've sort of talked to other experts in the field of patient engagement, patient experience, one of the things that has seemed elusive is being able to connect sort of the results that you're measuring to specific initiatives. And I'm wondering, to what extent do you see value in connecting, those measurables to specific initiatives, and how successful have you been in order to measure the actual projects that are contributing to those, improvements that you're seeing in the experience space?
Yeah, that's a great question, and I think we always ask the question: is there an improvement? Is there a meaningful improvement in the process and the outcome, in the ROI, whatever you're looking at to measure? So I'll click into that example that we were just talking about, that appointment choice example that we were just talking about. We've been measuring this for over 2 years now. We are able to tie appointment time choice to the overall experience when the patient comes in. They're statistically significantly linked. So you can see that not only does the experience just occur when you're within the 4 walls of your system, it starts all the way when you're making the appointment.
Right.
And so we can show that people that have satisfaction when they're making the appointment tend to be more satisfied when they come in. Think about it from your own life experience. If you're already irritated and upset about the appointment you were given, you're probably not starting off on the right foot when you come into the provider. And so that's how do we start to go way upstream, not just with check-in, not just with appointment reminders, but when you're actually making the appointment. So that's the type of data and measurement that we're able to show, that we can show statistical significance.
It's really interesting. And some of what you're describing sort of lends itself to, a term that I know has been gaining a lot of steam over the last couple of years in healthcare, which is digital front door. I've read research that basically says, patients are generally pretty happy with their doctors and their nurses, and it's sort of everything else like around the healthcare experience that's frustrating in terms of, as you described, scheduling, check-in, bill pay, so on and so forth. I'm curious, how do you personally look at sort of digital front door fitting into this whole ecosystem?
Yeah, so I would argue that, and what I always like to say is, it's not just one digital front, it's digital front doors.
Right.
So it's multiple, right? People can come in through MyChart, they can come in through our web portal, they can come in through the phone. Phone is still a common way that people come in. So they should have the same experience regardless of what door they're coming in. Are they walking into the ER? Are they walking into urgent care? Are they scheduling their annual physical with their primary care doctor? Or are they being referred to a specialist? So all of those channels are digital front doors. I think where we're focused is, to your point, how do we make it seamless? we always refer to the white space in healthcare. The white space is really where a lot of the friction occurs.
Hmm.
And those are the experiences in between when you're in the exam room with the provider. Most people, not all, I mean, let's be transparent, but most people, to your point, have a good experience with their provider. Let's just agree with, we can agree to that. It's the other things, like you said, it's the appointments, it's the referrals, it's the understanding of information, it's the bill pay, it's the understanding of their insurance. All of that type stuff is the frustrating. What happens when they get home? How do they get their medications? All of those things are frustrating. So how do we tie that together on the patient journey to eliminate friction as best that we can? And so that's where I think understanding the processes, tying these things together, asking the patient, but also helping the caregivers, right? We have to take friction off of the caregivers so that they can deliver this exceptional experience.
Yeah, it makes a lot of sense. And you touched on a topic that I want to get your perspective on, and that's sort of the notion of what happens when the patient goes home. And not just when the patient goes home, from the visit, but as, telemedicine, as hospital at home, as, remote patient monitoring, all of these, technologies that are really good for all the things you mentioned in terms of access and, a provider, burnout, the lack of physicians, the lack of nurses. There's a lot of really wonderful things to love about some of these elements of the technology ecosystem that are coming. But I'm curious, how do you sort of balance what's happening in healthcare in terms of all of those forces, and then staying, connected to that patient experience when that patient experience could be happening more and more outside of the four walls of the health system?
Yeah, that's a great question. And the way we think about it is if at the core of healthcare, it's still people taking care of people.
Yeah.
So we can't lose that. And I think that regardless of whether it's within the four walls of a clinic or a hospital, wherever, or now the four walls of the home, it's still people taking care of people. And it's people with needs that need to be addressed. So when we start with that premise, we can expound on that. And so, how do we understand what the experience is when you get home? Do you have unresolved needs? And so one of the things that we've done as an extension of our clinics is we survey people at 7 days to say, are there things that are unresolved from your visit that you need help with? Could be, I couldn't get my medications. It could be nobody called me to get that CAT scan done, or I haven't heard of my referral, or I got a bill and I don't understand it. What's going on? And so when we say, do you have any unresolved needs? And they say yes, it then asks them the category of what they're struggling with, and it routes to the right person. So if they have a billing question, it routes to the billing office. If they have a medication problem, it routes back to the nurse. If they have a referral problem, it routes to the referral team so that they can address the needs. So to your point, there's a lot of technology, and as people or as we're trying to keep people home or in their home or wherever location they need to be, how do we surround them to not just let them out and leave them out to flounder, hang on? How do we surround them with the services and that they need to be successful and healthy?
That kind of draws a direct line between patient experience, patient engagement, and outcomes, doesn't it?
Absolutely, because we're hoping to prevent people from deteriorating if they can't get their medication or they can't get better. We're hoping to prevent things from escalating into a grievance. And we're trying to build the connections if they haven't been called for their referral for whatever reason. Maybe we have the wrong phone number, or maybe they didn't answer. We can outreach to them to get them back connected with whatever services that they need, so that they don't fall through the cracks. Again, it's that, how do you remove the friction and not allow people to fall through the cracks along their healthcare journey?
Absolutely. Curious about the way that you look at your sort of overall patient population and whether or not you think about things like segmentation by, whether it's, diagnosis, service, even things like race or age or gender, at-risk populations. I'm curious about the way that, again, you think about sort of the patient population and if you've put either technologies, processes, philosophies in place to, I'll say sort of handle different segments of that population differently.
That's a great question as well. And so another area that rolls up through the Office of Transformation is health equity. Absolutely. So we're absolutely interested in equitable outcomes for all the patients that we serve. So one of the things that we've started in the pandemic, but we've really expanded, is starting to look at patient segments. So understanding that the experience for a 25-year-old Black female in the ER is much different than a 40-year-old male in the ER. So what are the drivers of that experience, positive or negative, for each segment and population, and how do we address those specifically? And so oftentimes you see overlaps. So, it's kind of the old concept of a rising tide that lifts all boats, right? So better communication for one segment. If you can fix communication in the ER, you're going to make everybody's experience better. And so it allows us to either design interventions specific for a segment or fix a broken process that we need to improve. We also have community health workers that go out and connect with patients in the community, get them connected with services, do their social determinant screening, do diabetes education, some other things. So we're really focused on how do you deliver care where people need to experience it in their homes, in their communities, in their neighborhoods, but also address some vulnerable populations. And how do we but also how do we measure their experience, right? We want to be able to understand how those populations experience healthcare and fix the barriers.
Absolutely. And if you can fix those barriers, I have to imagine, then there will be a greater likelihood that they take advantage of those services that are out there. They'll be healthier. And, again,
Absolutely.
a direct line between that engagement and that experience and that ultimate sort of quality of care that's being delivered to the community. So it's
Absolutely.
really interesting. How about in terms of dealing with, I'll say bias, right? That anytime that we go through a segmentation effort, there will be, biases that are uncovered, and I'm curious about what you're seeing there and how you sort of offset that.
Yeah, we've gone through a lot of unconscious bias training, and we've tried to educate our caregivers on unconscious bias and some of those things that a lot of health systems are doing. I think that's a difficult topic to address. It's difficult to uncover, and it's also difficult to address when you do uncover it because of all the aspects. And goes back to what we were saying earlier. At the end of the day, it's still people taking care of people. We all have unconscious bias. We all have our flaws that we have to deal with when we show up to work or at home. And so, how do you address that? And so I think it's being intentional, and it's going back to something we talked about earlier about being process driven. And can you be process driven to remove some of the biases? Can we set up protocols and order sets and other things that are that address or remove bias so that it takes some of that optionality or what we call unnecessary variation off of the table?
It makes sense. So I know that there is obviously a whole lot that's changing, in healthcare in general, and obviously in the patient experience, patient engagement space as well. What do you see coming as the future of patient experience as it evolves with all of these advancements in technology in our space?
I think we'll continue to see more personalization. I mean, I think as generative AI continues to evolve and mature, I think people want that personalized experience. They want that know me experience. And so I think what you'll see is instead of trying to funnel people down into one digital front door or one segment or one experience, we will be able to create more personalized experience. So your experience and my experience may be totally different based on our beliefs and desires and cultural aspects, but we're still going to, at the end of the day, we're still going to receive the care, whether it's diabetes, for diabetes or heart failure or whatever it might be. So how do you create those more personalized experiences? And I think that's kind of the next level of where some of the technology and some of the innovations are taking us. We've had this saying for a long time that we've only had one segment in healthcare, and it's called the patient. So how do we have personalized segments within healthcare to really drive that experience?
It's fascinating. I mean, it sounds like you're trying to meet people kind of where they are, which is,
Absolutely.
that's turning the whole sort of system on its head in a lot of ways, isn't it?
Yeah, absolutely. I always say if you're, as the chief transformation officer, if you're not making people a little bit uncomfortable, or I tell this to my team too, you should wake up every day thinking about what can change or improve. And if you're not making people a little bit uncomfortable, you're not transforming anything. So you really don't be afraid to push the envelope when it comes to, now that's not being disruptive, it's not being disrespectful, but how do we continue to push a historically slow moving industry into the future?
Yeah, I mean, that's the million dollar question in a lot of this. And it's really fascinating, just the energy that Community Health Network puts behind this. I mean, from the very, very top. Obviously, from the executive level, I have to imagine that this is something that is, universally sort of important to your peers in that executive suite too, right?
It is. It's one of the things that we feel like differentiates us. And we have brand studies and other things that tell us Community Health Network is easy to deal with. We're friendly. We're like family. We're easy to get into. Some of those types of things that really and at the end of the day, right? A lot of healthcare is still word of mouth. So when you create those exceptional experiences, people will tell their friends and family and loved ones that that's where they need to go.
Absolutely. So I'm wondering, do you have any advice? Obviously, you and Community Health Network as a whole are really on the leading edge. I mean, to be in the top 1% of healthcare, as you say, is sort of a feat in and of itself. But to be able to benchmark yourselves against, non-healthcare organizations that are world class, regardless of industry, is really something special. So I'm curious about the advice that you'd give to other healthcare executives, your peers, even, vendors like us that work in the patient experience space. What advice would you give to healthcare executives and others that are looking to, make strides in this space?
Yeah, there's typically a couple things that I typically tell people. One, something we just talked about, don't be afraid of change. Healthcare is changing all the time. Society is changing. Our culture is changing. Everything around us is changing. So don't isolate healthcare and be afraid of change. I mean, think about new treatments, new therapies, new medications, new other things. Change is around us. Don't be afraid of change in healthcare, and don't necessarily resist change when it comes to. There's always change for the better. I think from leaders, what I always tell people is be curious. You have to have, in a lot of ways, we've sometimes lost that curiosity. So be curious when it comes to looking for new solutions, new technologies, new ways to improve that patient experience, patient outcomes, patient care. How can we improve the processes? Be curious. Don't lose your curiosity. Allow your teams to be curious. I think that's the other thing as a leader. I want my teams to be curious so that they can find, because oftentimes they are the leading edge, they're the cutting edge. Allow them to be curious. And then the last thing I always tell people is all of this change, transformation, everything that we're going through, it takes courage. So you've got to be courageous as a leader to be able to lead through some of this change, to be able to help people when they need help, support your team when they need support, but also give them the vision. Be a leader and lead your teams through all of this change.
Yeah, I think that is advice to live by if I've ever heard it. This has been really wonderful, Dr. McGill. And to wrap up, is there anything else that you're working on, excited about, anything else at all that you'd like to share with the community?
I think we're excited about the future, right? I mean, we're excited. Change is changing at an accelerating pace, and I think we're just excited. It's an exciting time to be in healthcare. It's an exciting time to be dealing with technology, and so it goes back to all the things that we were talking about. I think that's that's what I'm excited about. Of course, we're working on all the different technologies and how do we manage AI and how do we make the caregiver experience and patient experience better. But it's just an exciting time to be in healthcare.
It really is. It's a wonderful spot to be. Things change. It seems like today on like a minute by minute basis in some respects.
Yeah,
So
absolutely.
I really, really appreciate you taking the time today. This was a great conversation. And as I always say to our guests, I hope that you will come back and give us an update as you continue to move through this process, because there is just so much change and so much white space still to be had. In terms of improving the lives of patients and providers and everybody else that's associated with healthcare. So, and thank you for the work as well. What Community Health Network is doing is really a bastion for the industry to follow. So, thank you.
Yeah, I appreciate it. Always happy to come back. I appreciate you having me on and allowing me to tell our story for all 16,000 people at Community Health Network.
Absolutely. And thank you also to our listeners. If you enjoyed the conversation, please like, share, and subscribe to help us keep growing the show. And if you'd like to learn a little more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare. That's our show for today. And until next time, I'm Chris Civitaris, wishing you health and good cheer. Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer. Podcast music by Nicholas Bach.